Last week, we gave the Trump administration credit for trying to fix the Obamacare risk adjustment problem. A few weeks before that, we noted they seemed to be sabotaging the Affordable Care Act by creating the problem in the first place. This week, we're back to sabotage. This is Healthcare Triage News. This time, it's short-term health insurance plan. Let's review. The Affordable Care Act tries to stabilize the individual insurance market by instituting guaranteed issue and community ratings. See, in the old days of 2013, insurance companies mostly used a business model of trying to attract healthy people and avoiding the sick ones. They'd look at each individual who wanted to buy insurance and then decide, one, if they wanted to give it to them, and two, how much they'd charge them. You have diabetes? No insurance for you. Ulcer colitis? Yeah, thanks for playing. You want to have a baby? Not paying for that. This meant that insurance was super expensive for many people who needed it most if they could find a policy. The Affordable Care Act changed that by one, requiring that insurers offer everyone a policy, and two, charging everyone pretty much the same amount. Now, this doesn't mean that insurance companies can't make money. It just changes the business model. Many companies adapted and are chugging along just fine. But sometimes you change jobs. You're moving to a new one, and you'll have a few month gap in between. You're healthy, you don't want to have to pay for an expensive policy for 2 months until your new job starts and it starts buying insurance. You just want some cheap protection to hold you over. You'd go buy a short-term health insurance plan. And under the old rules, you can only buy such a plan for 90 days. It was meant to be short-term. It didn't qualify you for being insured under the individual mandate, so you'd still need a real policy to replace it. And that's where the news comes in. The Trump administration has issued a new rule that says that short-term policies can now be issued for up to 364 days. A regular insurance policy, on the other hand, is issued for 365 days. Can you detect my sarcasm here? Further, these short-term policies can be extended for up to 3 years. You know what we call such short-term plans in the biz? Insurance plans. There's no magic here. Short-term plans are cheaper because they're skimpier. You don't get something for nothing. They don't have to cover the same health benefits like mental health care, prenatal and maternity care, drugs, or even hospitalizations. They also don't have to cover pre-existing conditions. They're meant for healthy young people, and that's who will go to them, which will leave the people covered by the Affordable Care Act older and sicker. And everyone's plans will get more expensive as a result, and you get to the whole death spiral thing potentially. And do we have a graphic for that yet? The stated reason for doing this? Affordable Care Act plans are too expensive for many people, and this will offer them a cheap option. Where to start? Affordable Care Act plans are more expensive because of the sabotage. It looks like the average rate request this year is about a 6.9% increase, and that'll likely come down once states finish reviewing them. But without the sabotage, and this is a good example of the sabotage, rates might have gone down. But we got rid of the individual mandate, we screwed with risk corridors and navigators, and now with short-term plans, and that makes everything more expensive. And that increased expense is then used as an excuse for more sabotage. So we're back to that. Less, please. Hey, do you like the show? Really helps if you subscribe or like it right down there. And another great way to help the show is a subscription service known as patreon.com, where you, the viewer, can help support the show for as little as $1 a month or more, whatever you like. We'd especially like to thank our research associates Joe Sevitz, Jonathan Dunn, and Crafty Geek, and of course, our Surgeon Admiral Sam. Again, if you'd like to support the show, patreon.com/healthcaretriage, as well, httmerch.com for all your great healthcare triage merch, and of course, my book, The Bad Food Bible, still on sale in stores. Please buy a copy.